Welcome back to Medical Monday. We are talking with orthopedic surgeon Dr. Jason Haslam, talking about everything that mainly affects from the fingertips to the shoulder, although you cover all the body. One thing that piqued my interest, these wrist replacements. I've really never heard of that. Something you see, though, quite often. Yeah, these are fairly new on the market, these wrist replacements, and they're becoming much more popular because in all honesty, they're getting better and better. And we do use these fairly frequently for patients that have had, for example, post-traumatic arthritis. For example, the wrist joint is the most common joint that's fractured when patients fall down. And those fractures can lead to joints that become arthritic, and they wear out and become very painful. And in those situations, this may be a very good alternative as a joint replacement. So we use them fairly frequently. And many patients are very happy with them because you can preserve some motion and they get pretty good pain relief with it. Once you do the replacement, is the relief pretty, is it immediate once they wake up from surgery? Can they tell the difference?
Yeah, absolutely. Most patients can tell the difference. Of course, you have that post-surgical pain, which can be quite painful.
Sure.
So, but once that starts to wear off and they start to move their wrist, they start to notice improvement, and a lot of them are very happy with it. Yeah, absolutely. It's a great alternative. We used to do a lot of fusions for this particular problem, but now as these devices become better, we're starting to use them more frequently.
Well, I imagine if you're fusing the wrist, you would lose a lot of mobility, right?
Absolutely, and that's the biggest complaint about wrist fusions is the lack of mobility. So it is a nice alternative for that.
Okay. I do want to mention we have a couple of lines open, so if you want to give Dr. Haslam a call, now is the time to do it because we are running short on time for the hour. We have about 15 minutes left. 615-737+, and we have Donald on the line. Donald, thanks for being with us tonight. What's your question?
I have muscle problems in my back, my arm. I actually have knots similar to the Charlie horses we used to get when we were young. I'm over 60, still very active. I play basketball with young men, load stuff, but I have a real hard time sleeping the day or so after it hurts so bad.
And where exactly are these knots at? Are they in your arm, or are they around your neck, or where exactly did you say those were at?
I have one in my right arm. I have one underneath my left shoulder blade.
So what's interesting that you talked about, you mentioned, you started off with your neck and your back area. So the neck supplies all these nerves that go down to the arm, and it's always in the back of my mind. I'm always worried that it might be an impingement on the nerves around the neck that may be causing upper extremity problems. So it's very possible that might be what the cause of these Charlie horses. If those nerves are irritated as they come out of your cervical spine or your neck area, it'll irritate the muscles, and then a lot of times patients will get those Charlie horses or those knots. It's very possible that could be where it's coming from. A good physical examination might be able to tease that out. I'd certainly encourage you to come to the office and let us take a look at you.
All right, Donald, good luck with that. And of course, we're going to give you that number, so get a pen and paper ready. When I was reading through some of your notes that were prepped for this show, Dr. Haslam, one of the syndromes that you listed that you deal with, it has to deal with cold hands. And I've always heard the saying, oh, you have cold hands, you must have a warm heart. There's actually a syndrome that deals with cold hands. Tell me about this.
So it's kind of interesting. There's a group of patients that have a syndrome called Raynaud's syndrome. And many patients that have this particular problem, if they get in very cold environments, it actually can clamp down the vessels that go to the tips of the fingers and cause damage to the tissues. And for many patients, it can cause ulcerations around the tips of the fingers. There are treatments for it. Most of them are medically based. There are some surgical treatments that can sometimes help that. But if you're apt to get ulcerations, they can be very painful at the tip of your fingers also. But it's called Raynaud's syndrome or Raynaud's disease.
Is it very common, or is it very?
It's not very common to see, but it can be quite debilitating for many patients that have it.
I just didn't know that was even a thing. That's very interesting.
We see that frequently.
Learn something every day. Travis is waiting ever so patiently on the line. Good evening, Travis.
Hello.
Hi.
I was out doing the Easter egg thing, and I tripped and fell, and ever since then my shoulder's been hurting. I normally sleep on my side, and it's affecting my sleep. My doctor said I probably need to come see an orthopedist and try to find out what was going on with it. He said something about maybe a rotator cuff or something like that, maybe a partial versus some kind of full tear or something.
So what you're describing is one of the more common complaints around the shoulder, is where patients have had a fall and they have a lot of pain after that fall, and it just persists. It becomes a problem at night. You can't sleep. You roll over on it, it wakes you up immediately. It can be absolutely debilitating in terms of what you need to do the next day and work activities. So very common scenario that you've described. So what most likely has happened is you've taken your shoulder's a ball and socket joint. You've taken that ball and socket joint and you've forcefully moved it either up or around that socket, and there are structures that sit just above it, which are bone, and there's a little interface between that bone and your rotator cuff, and most likely you've probably injured the rotator cuff tendon or that bursa space that we've talked about and caused this inflammatory response. Many times you haven't done tears or major damage, you've just caused an inflammatory response. Many times these things will get better with some time, anti-inflammatories, but like you, the suggestion is maybe come see an orthopedic surgeon, and that's what we do. We see this all the time, and a lot of times if it's not getting better with our anti-inflammatories in time, then we'll start treating it with maybe perhaps an injection with some cortisone around it. That sometimes helps. If it doesn't get better with that, then we have other more aggressive treatments, including physical therapy. And sometimes we have to get advanced imaging studies, for example, an MRI, and that'll give us a lot more information about what might have happened to your shoulder. But hopefully it can get better for you. Again, it happened fairly recently, so there's a good chance it might just go away. But if it doesn't get better, we're certainly available for you, or any orthopedic surgeon will feel very comfortable taking care of that for you. Okay,
thank you, Travis. Good luck there. Robert is also on the line. Good evening, Robert.
Good evening, and hello to you, Doc.
Hi.
I'll try to make this quick. In 1990, I was in a head-on car collision, and my right collarbone was crushed, and the ball joint, area was damaged. Well, it took me 14 years and not being able to get out of bed anymore because of the pain for me to go and get it surgically repaired.
Yes.
And at the time, the orthopedic, a great surgeon up in Chicago, he said that this was a one-time event healing the damage in the scar tissue that formed, by waiting so long. Well, 4 months ago, I had an unusual fall where my orthopedic says I may have suffered an impingement in the ball joint area.
Yes.
I've gone through 2 cortisone shots, and I don't know really where to head from here. Should I just ask for an MRI and then hope that whatever damage, because the pain is still unbearable. I'm, like reaching behind with my right arm behind my head. The pain is unbearable, and same with just moving my arm, like in the sitting position to the right. I can feel everything in that ball joint area.
Don't do it. I can tell you're doing it right now.
Yeah, what you're describing an old trauma to the shoulder area. So in my mind, the red flags of perhaps that joint has some problems with it. For example, you may be developing arthritis in that shoulder. Certainly, to request an MRI is certainly reasonable. I'd probably start off with just a good old-fashioned X-ray around the shoulder just to make sure that that ball and socket joint is actually okay from an imaging standpoint. A good physical examination can sometimes tease out the diagnosis. You had mentioned impingement syndrome. It's very common. That's where the ball impinges on the bone just above it, and it can cause irritation. But because you have that history of old trauma in the past, I'd certainly want to get an X-ray to make sure that there was no post-traumatic arthritis. It sounds like you have a lot of stiffness in your shoulder joint, and it may be related to that.
Yeah, sounds like he needs to get in somewhere and not live in that pain.
Yeah, especially if it's lingering like that. Come in and see us. We'd be happy to take a look at it.
Okay, on that note, I want you during this commercial break to go grab your pen, grab your paper. When we come back, the numbers, the website, the email, everything you need to get in hold of Dr. Haslam. Stay with us.